Dr. Dona here, a youth and adult psychiatrist, here to discuss all things mental health and wellness related. Today I'm going to discuss SSRIs, or Selective Serotonin Reuptake inhibitors. Please remember, all the information I'm discussing, I'm able to discuss because I am a medical doctor and a psychiatrist, but also know I am not your medical doctor or your psychiatrist. So if you have any burning questions or concerns regarding your medicines or SSRIs in general, I would reach out to your medical doctor or psychiatrist if you have any additional concerns or questions that you wanted to bring up. So, SSRIs, and why am I talking about them? So, SSRIs are among the most prescribed psychiatric medicines that are prescribed just in general, and it's the medicine that I prescribe the most within my practice. So, I do think that this is why it's going to be an important topic for me to discuss, so that you have more information about the SSRIs available and about side effects and how to take them properly. So SSRIs, or otherwise known as selective serotonin reuptake inhibitors, are a class of medications commonly used to treat depression and anxiety disorders. While they all function by increasing serotonin levels in the brain, they differ in terms of chemical structure, side effects, onset of actions, half-life, and specific indications. Typically, SSRIs work by actually altering the transporter receptor of serotonin in the brain, so that when they alter the transporter receptor, that's what allows them to actually be more readily available in your brain. So most common SSRIs are going to be Prozac or fluoxetine. So fluoxetine is the generic name and Prozac is the brand name. This medicine has the longest half-life of all the SSRIs, and it is about 4 to 6 days, so it takes longer to leave your body. When we say half-life, that's the amount of time that it takes to actually leave your body. Its indications are for depression, OCD, bulimia, panic disorder, and other anxiety disorders. Side effects of this medicine can be that it is the most activating SSRI, so it can potentially lead to some anxiety initially or some insomnia. Zoloft, or sertraline, which is the generic name, the half-life is about 26 hours, and it's indicated for depression, anxiety, PTSD, OCD, and other social anxiety disorders. Side effects are that while they're generally well tolerated, it might cause some gastrointestinal or GI side effects. GI side effects are among the most common side effects for all the SSRIs, but they usually will go away within the first few days of taking these medicines. Citalopram, or Celexa, the half-life is about 35 hours, and it's indicated for depression. Side effects are considered typically mild, but higher doses can cause heart arrhythmia, heart rhythm issues such as QT prolongation, so it is advised to check your EKG, or if you have prolonged QT issues, to not take this SSRI specifically. It's generally considered a good option for elderly patients if they don't have those issues. Escitalopram, or Lexapro, the half-life is about 27 to 32 hours. It's indicated for depression or generalized anxiety. Its side effects are similar to those as citalopram, but it generally has fewer side effects, and it is considered a cleaner version of citalopram with fewer drug interactions. So if you're someone who has to take a lot of medications for a lot of different medical comorbidities, Lexapro might be the medicine that you might consider. Paroxetine, or Paxil, the half-life is about 21 hours, so it's short. It's indicated for depression, anxiety disorders, OCD, PTSD. The side effects are that this is the most sedating SSRI, and it can potentially cause weight gain and more sexual dysfunction. All of the SSRIs can potentially cause sexual dysfunction, but Paxil is the one that it can happen to more often than the other ones. So that would be something to keep in mind. Also, because it has a shorter half-life, it has a higher risk of withdrawal symptoms. So that would be something to keep in mind if you're going to stop taking this medication abruptly. But it could be something to keep in mind if you have issues with going to sleep, because it is sedating, so it can help you with going to sleep. Fluvoxamine, or Luvox, the half-life is short, about 15 to 20 hours, and it's primarily used for OCD, obsessive compulsive disorder, but can also be used for depression and anxiety. The side effects are again similar to GI issues, but can also cause some sedation as well. This medication is used more cautiously just because it sometimes can have more drug interactions and is less often used for depression primarily. The key differences that I just mentioned are half-life, with Prozac being the longest, and the Paxil and the fluvoxamine having the shortest half-life, and some SSRIs are more activating. Fluoxetine is the most activating, and Paxil or paroxetine is the most sedating SSRI. And this can influence their use based on the person's symptoms. So if you're needing one that it needs to be more activating versus sedating, this is the things that you would keep in mind when you're choosing an SSRI. And while all SSRIs are used for depression, some have additional approvals in FDA, such as for anxiety, OCD, or PTSD. Something else to keep in mind is that certain SSRIs, like fluvoxamine, can have more potential interactions with other medication, and the choice of SSRI often depends on the specific symptoms that someone is having, a patient history, side effect profile, and other individual factors. So in terms of activation, and this is something that I had mentioned before, here's a general list of the ranking from most to least activating SSRIs. So the most activating is fluoxetine or Prozac, and it can increase energy levels and may cause insomnia, especially when starting. So these are things to keep in mind. Sertraline or Zoloft is moderately activating, and it's often used for patients with depression and low energy or those with anxiety. It can also cause some agitation or insomnia. Escitalopram or Lexapro is neutral to mildly activating, and it's generally well balanced, though some patients might feel generally energized. Celexa or citalopram, it's considered neutral, middle ground, and it's neither particularly activating or sedating. Luvox or fluvoxamine is slightly sedating, and it's primarily used for OCD and tends to be more calming, but it is not the most sedating SSRI. And paroxetine or Paxil is the most sedating SSRI, and it's often associated with fatigue, drowsiness, and sometimes weight gain. Other questions I might get asked about SSRIs are, it doesn't matter the time of day and when I take it. And yes, sometimes it can matter when you take your medication or your SSRI, but it also depends on when you tolerate it and other lifestyle factors. So if one of the SSRIs that you're taking is activating versus sedating, that might contribute to when you're taking it. Like if you're taking the most activating SSRI, like fluvoxamine or sertraline, they're better tolerated in the morning to avoid insomnia or restlessness at night. But I will also say that I've had some patients tell me that they've had some fatigue or drowsiness on Prozac, so they sometimes take it at night. So this is where everyone can be different, but this is just kind of a general guideline. And sedating SSRIs like paroxetine, they're often taken at night to take advantage of their calming effects and to minimize daytime drowsiness. In terms of consistency, SSRIs best work when taken consistently at the same time each day. And this is because it helps maintain stable levels of the medication in your bloodstream, which is important for effectiveness and minimizing side effects. In terms of side effects, I had mentioned these before too. You might experience some nausea or gastrointestinal discomfort taking your SSRIs. So I will usually suggest people to take it with food or in the evening to sometimes help mitigate some of these side effects. And sometimes the SSRIs might make you feel drowsy or fatigued during the day, so switching to an evening dose might sometimes decrease this. Also, something I really keep in mind is lifestyle factors. So considering your daily routine. If taking medication at a certain time of day consistently better fits your lifestyle, like taking it with breakfast or before bed, these things are things to keep in mind, that if they're going to help you be better with adherence or taking your medication consistently, because this is honestly the most important thing that's going to be helpful for you for maintaining that routine with taking the medication. It's always best to discuss with your healthcare provider when to take your SSRI, especially if you're experiencing side effects or having specific concerns. They can always help provide guidance tailored to your situation. Again, I am a psychiatrist and a medical doctor, but I'm not your doctor. So if you're having specific concerns about an SSRI or your medication that you're taking, please discuss with your doctor specifically. This is Dr. Marie Dona. If you thought this was helpful or have any additional questions or concerns regarding SSRIs, feel free to leave a comment. Please like and subscribe if you thought this content was helpful, and we'll see you in the next video.